Right now in the US, we're doing the biggest experiment we've ever done. We have 17% of the GDP that's being turned upside down. What do I mean by that? It used to be we're physician-centric. And really we were business-to-business industry in the sense that you had the payers who are negotiating with the employers, and then they deliver 10 or 15,000 patients to hospital providers who contracted with physicians. That's the old models. We are turning into a system that we call retail medicine. And retail medicine means that we are changing the accountability of who is going to pay. And that means is that it's being shifted away from the employers and the payers, and it is being pushed towards the providers and ultimately the patients. As a result of that, everything in the industry is being turned upside down. Medical devices being de-emphasized, and we can spend more time afterwards on that. But more importantly, now we have to equip the patients on how to basically take accountability. And that goes all the way from giving them the right information at the right time so they make the right decision. If you think about it, if you want to buy an expensive car, you can go on Consumer Reports, you can get all the information on the internet, you can make an educated information. If you need a medical procedures, good luck in trying to figure out what is the right procedures for me, what is the right place to have it delivered, what's my recovery, what's my preparation. So it's not as organized. So what you're having is a massive revolution of new technology coming into the market. Some of them are what I call dumbed down medical device, not in a negative way, but just enabling the physician to take charge. So for example, there's a company called AliveCor, which allows you to have a special shell that goes in behind your smartphone, will be an iPhone or an Android. And if I put in the back, you can see, if I put my fingers in there, it's going to deliver my EKG. It gives 60 seconds of my EKG. And right now I'm at 65, which is pretty good since I'm being interviewed. And after the 60 seconds, it records it. I can send it over the air to an interventional cardiologist or tech specialist who can do an analysis if I am thinking I'm having any type of abnormal symptoms. I can add to it, I had palpitation, I had chest pain, I wasn't feeling right. And so these are the type of technology which really existed in the diagnostic setting, in provider settings there, and now where we are enabling them for change using mobility and using services, we're enabling to bring that expertise to the patient at home or where they are. That's one example. And so the other one I'm sure you have seen is the Fitbits, which is kind of keeping track of your activity. That market is evolving extremely fast there because I think next week, which is by the time you see this will have happened, Apple is going to be launching a new smart wrist. We also know that Samsung is working on it. And I think right now you're going to see a lot of this technology that's going to be integrated into a device that's going to be on your body or even in your clothes. So what is happening as a result of that is that there is all this new technology, all these new sensors are coming on the market that are going to monitor your vital signs. And remember, 75% of the problems in the US healthcare system are due to chronic disease management or mismanagement that could be prevented. So we're going to move from a system that was waiting for you to have symptoms, where a doctor was waiting in a centralized location with all the skills and technology and expertise he needed to make a diagnosis and treat you after you had some serious symptoms. And where a typical doctor will see probably 20 to 40 patients a day, to having now patients that are being managed just proactively where they are all the time in a way that we're going to try to motivate them to change behaviors and hopefully measure an outcome, which means lower cost, that somebody's willing to pay for. And that's the one we're still working on how that's going to work out. And so it's a fundamental change of the roles of all the players in healthcare.